So you got a disc herniation or sciatica, pain in the back or going down the leg. What do you do if you're trying to exercise and you start to feel some pain? My name is Dr. Grant Elliott with RehabFix, here to talk to you about why hurt doesn't always equal harm and how you should know the difference between a bad pain or a good pain. Okay, so understanding our pain, understanding pain mechanisms is extremely important. And I know many of you out there are struggling with these kind of disc herniations in there, and you're being told a lot of different messages about, oh, bending over can make it worse, or these different exercises can make it worse, and just rest or stay on your couch. A lot of BS advice that we know at this point is not effective and is only going to make things worse. So one example I want to give you, one analogy I want to give you is hurt doesn't equal harm. Hurt does not equal harm. And what's an example of that? Here's an example. Just thought of a good one. Let's take my arm as an example. I'm going to pinch my skin. Pinch. You can pinch your arm right now. I'm going to squeeze. It hurts, right? Ah, man, I got to pinch. Why am I pinching myself? To teach you guys a lesson. So when I pinch, it hurts. But when I let go, it goes away. And check that out. It's okay. My arm's okay. It's intact. It's not like I ripped the skin off. It's not like I'm bleeding. It's not like I have some giant bruise already, but it hurt, right? So just because this hurt does not mean it is worse. It does not mean I'm making anything worse. And although low back issues can be very concerning, very scary, you can't really see what's going on in there, it's the same. It's the same. So take a deep breath. If you're experiencing some low back issues with certain exercises, certain movements, certain positions, I know that it sucks. Trust me, I talk to people all over the world with low back issues. I know that low back pain sucks, but I'm here to give you some encouraging message, some empowering messages that not a lot of people are given, and that's that hurt doesn't equal harm. So just because, let's say I'm doing some squats and I love squatting, okay? Or riding my bike. I love riding my bike, or deadlifts or lunges, or walking with my kids, whatever it might be. If I get a little bit of low back pain with that, I don't want to become overwhelmed. I don't want you to get freaked out. I don't want you to obsess over it, because hurt does not always equal harm. So I want to encourage you to maintain normal activities. The more you move, and the more regularly you live your life, the better you're going to be, the better your prognosis is for these sort of low back issues. The true disability comes with what we do with our pain. Some pain is normal, but it's what we do with that pain that can lead to disability and suffering. So I want to encourage you that if you've been fed any sort of harmful or scary or threatening messages like, oh, if you ever feel pain, stop right away, maybe reconsider those. And remember, that hurt doesn't always equal harm, and you're gonna be okay. Live your life normally. Be excited to continue to exercise or do some movements. And sure, you might need some extra help. You might need some more specific movements, a structured plan so that you can completely resolve these issues so you don't have any kind of hurt, because, hey, we don't want any hurt. But I just want you to be empowered knowing that you probably are not making anything worse, that you can be positive towards continuing to move and living your life the way that you want to. So, get out there, keep moving, stay empowered, and let's fix your low back.